This is PR Madhurikaa from Saveetha College of Physiotherapy. I'm really delighted and very honored to present my project, Effectiveness of Bilateral Arm Training and Motor Relearning Program in Upper Extremity Function among Stroke Patients, which is guided by Dr. Pratap Sugendra Babu, Principal of Saveetha College of Physiotherapy. As we go on to the introduction part, As we go on to the introduction, stroke is the third leading cause of death and #1 cause of adult disability worldwide. Over 85% of stroke survivors suffer upper limb deficits. Only 5 to 20% of the people regain the overall upper arm functions. In this topic, I have taken only the participants who are suffering from hemiparesis of upper extremity. And hemiparesis affects daily activities like eating, dressing, and writing. In hemiparesis, recovery is slow, and conventional rehab shows limited upper extremity movement. Thus, exploring the other research papers that has been published and evidence of neuroplasticity driven strategies, I have chosen bilateral arm training as my experimental group. Review of literature part, I have added the most recent studies which have shown better results in bad bilateral arm training than other traditional physiotherapy techniques and motor relearning program, as well as other techniques which has been commonly used for stroke patients. As we come to the background of the study, stroke often leads to a long-term upper limb impairments. These deficits limit daily activities like writing and normal daily activities. And traditional rehab have that gap of filling that training of daily activities. So in bilateral arm training, which uses both arms to boost the motor recovery, but involves the weaker side more, that fills the conventional gap between the conventional therapy, normal physiotherapy techniques, and bilateral arm training. And literature shows bilateral arm training enhances neuroplasticity and reduces learned non-use and may improve motor function better. And as we come to the need of the need of the study has been clearly explained on the previous studies where the daily activities of living has been interrupted, and bilateral arm training is a promising intervention using neuroplasticity and interhemispheric connectivity to aid recovery. The study findings will provide and support evidence for bilateral arm training and guide clinicians in rehab decision making. The main goal of the study is to improve the quality of life by identifying effective approaches for upper limb recovery. The aim of the study to analyze the effectiveness of bilateral arm training and motor relearning program among hemiparesis of hand in stroke patients. The main objectives to analyze the upper extremity function in post hemiparesis stroke patient who underwent bilateral arm training, and to analyze the upper extremity function in post hemispheric stroke patients who underwent motor relearning program, and to compare the effects between the bilateral arm training and motor relearning program. In this study, I have mentioned the methodology of the study, which includes study design, subjects, sampling technique, and sample size, inclusion criteria, exclusion criteria, and study procedure. In the study design, I have taken experimental study. Subject were selected from Saveetha College of Physiotherapy and other resources. Sampling technique, I have taken convenient sampling, and sample size of 40 has been reduced from a sample size of 100. In inclusion criteria, I have taken age from 45 to 60 years. Both male and female participants have been taken after a unilateral stroke at least 6 months, and the capacity to obey a basic commands, which is calculated using a mini mental scale, should be in or above Brunstone grade 3. And in exclusion criteria, I have added uncontrolled diabetes, significant orthopedic pain conditions, excessive spasticity based on the scoring of modified Ashworth scale, and any cognitive dysfunction, pericarditis, heart failure, and musculoskeletal abnormalities has been excluded, and any other hindering intervention have been taken patients have been excluded. And in the study procedure, the study included stroke patients with hand hemiparesis meeting set of criteria which has been explained previously, and they have been informed consent. 40 participants have been randomly taken into two groups, control group and experimental group. The control group received motor relearning program and the experimental group received bilateral arm training. In this slide, I have mentioned a few pictures of the training that has been given to patients in Group A and Group B. Group A, which is bilateral arm training, received the treatment for 8 weeks, 5 days a week, a session of 45 minutes. Activities were reaching, grasping and manipulating objects, which can be modified according to each patient's level of spasticity and level of impairment. Intensity increased by task complexity and duration. 30 seconds to 60 seconds were given rest between the tasks to avoid the muscle fatigue. And in Group B, same treatment lasted for 8 weeks, 5 days a week and 45 minutes session. Exercises were done in seating position targeting grasp, grip, gross motor skills and upper limb function. Active support was provided during task. And for the outcome measure, I have taken Fugel-Meyer assessment scale. Fugel-Meyer assessment scale, which is one of the most gold standard scale for stroke survivors to evaluate the motor function. In this scale, I have taken the upper extremity for the patients, which included reflex activity, movement and synergy, which is a basic movements in a fixed position, and movement with mixing synergies, which are more flexible and combining movements like reaching and turning, and out of synergy movements, which is an isolated movements for elbow, shoulder lifting and straightening, and all these movements were included in the out of synergy movements. And basic wrist movements, hand movements and coordination speed are also been evaluated. It is a score of maximum of 66. In the post-test values of both group, bilateral arm training showed more improvements than motor relearning programs. In both groups had an improvement significantly, but bilateral arm training had a higher post-test values. This is done using a Mann-Whitney U showed the significant difference between bilateral arm training and motor relearning program. In the discussion part, I have taken research studies which has been over a decade and the present research studies to see the difference in the research that has been in the bilateral arm training and the comparison of bilateral arm training to other methods which has been recently developed. And according to my research, bilateral arm training has been showed more improvement in patients with hemiparesis of upper extremity than motor relearning program. As we see, both motor relearning program and bilateral arm training showed a significant result. There is a slight difference in the post-test values which has been calculated, which is showing bilateral arm training has been more effective than motor relearning program. In the conclusion part, bilateral arm training is more effective in improving the upper extremity function in stroke patients. The outcomes may vary depending upon the severity and the timing and the type of patients we treat. Bilateral arm training are versatile and adaptable and suitable for many stroke survivors independent of all the grade groups. So bilateral arm training showed a higher improvement in upper extremity function. These are the references that have been used for my previous slides, and thank you for the opportunity. Thank you Saveetha College of Physiotherapy and beloved Principal Dr. Pratap Sugendra Prabhu for this opportunity. Thank you all.